Hi, this is Dr. Phil Smith, back again with part two of my 8-part series on solving the MedRec problem, deconstructing medication reconciliation. Today I'll be talking about what patient factors impact MedRec. A little bit about me, as I discussed before, you can read this at your own pace. But what I really want to talk today about the patient factors that impact the 30 common failure points that prevent us from getting a true and accurate list of current medications from the patient. So I've zoomed in on these so you can see them a little more clearly, but let's break them down into the individual components and what they mean. So as we talk about patient factors, the first is culture and beliefs. And we know that we all come from different cultures. Not everyone comes from a Western culture. They may have an experience with tribal or herbal interventions, holistic interventions, things such as acupuncture, prayer, meditation, yoga, biofeedback, all types of different things. And I'm not trying to judge whether any of these are good or bad. It's just you need to know the context of which ones the patients is using when they're evaluating whether or not they should take a medication and what they're reporting back to you. And they may be slow to tell you about herbal interventions that they may be doing on their own or on the advice of a friend. Accessibility of care has to do with the availability of getting medications, ability to get medical care. They may actually not be compliant with medication coming from another doctor because they have accessibility problem. They may be live far from the doctor. They may have transportation issues. They may actually not be seeing a doctor that you think they are, or they may have problems getting into you to get refills. So these can certainly impact what medications a patient is actually taking. Cognitive abilities could be impaired due to congenital issues, due to stroke, due to medication, intoxication, drug use. All types of things can impact our cognitive abilities and can affect our ability to recall an accurate and true list of medications. Likewise, education may be an impact to knowing what medications the person is taking, as there may be healthcare literacy issues. It's been shown that perhaps as many as 80% of Americans have some deficit when it comes to understanding the language of healthcare and know what someone means. For instance, when I say taking medication 4 times a day to a patient, I'm assuming they're going to take one when they get up, one at bedtime, and 2 sometime in between around lunch and dinner time. But for them, it could be taking all 4 tablets at once to get those 4 doses a day in, or it could be the other person is taking them every 6 hours and setting an alarm clock in the middle of the night to get up and take one at 2 a.m. to keep on schedule. Finally, there's adherence to prescribed medications, and there may be issues with the patient being totally transparent to compliance. Maybe they can't afford a medication and they're embarrassed to tell you, or they've mixed up their medications and they don't want to share that information for whatever reason. They may be having some side effects that they may be just uncomfortable sharing with their doctor. There are all kinds of different issues. Likewise, impacted by cognitive and educational deficits, there may be confusion around understanding around dosing and administration. And don't assume that the patient is always a reliable source of medication history. There may be many factors, and some not listed, that may be impacting our ability to have a good recall of what medications the patient has taken, or there could be problems where a patient caregiver or guardian, or perhaps even a parent, doesn't fully know what the regimen is due to any factors. So this wraps up the patient factors. Next time I'll be talking about disease and condition factors in part 3. Again, if you haven't downloaded the ebook, here's the URL. Thanks for joining. More in part 3.